Hi, Professor Simion and fellow classmates. Welcome to my presentation, my industry use case. We're focused on the health industry, and my presentation is titled AI and Analytics in Healthcare, looking at fixing claims starts with fixing data. What is the business case? What is it all about? Uh, it's primarily about healthcare is one of the most data-rich industries, yet one of the most administratively inefficient. And I chose this because my medical billing and coding background and supply chain experience made it immediately familiar. The fragmentation that limits AI in claims processing is the same root cause I've seen derail analytics initiatives in procurement. What the literature confirms. The literature overall confirms that AI tools in healthcare revenue cycle are not the problem. There is adequate investment in AI, but the problem is with the data layer and the fragmentation of data. So revenue cycle AI is mainstream but constrained by data. That's a conclusion from the case. And from the supporting data, Davenport and Mittal confirmed that truly AI in driven healthcare organizations remain rare. And also from Davenport and Harris that data management is the foundation, not an option. My summarized analysis looking at the path forward. So one, the overall outlook for AI in the health industry is positive, and especially when foundations are built. So for example, Eli Lilly had a 20% reduction in clinical trial timelines, and GE saved over 40 million from improved data integration. Incorporating from the lesson material, Simion's maturity framework, we're looking at organizations evolved from descriptive to predictive to optimization as data maturity improves. The healthcare sector is broadly at the descriptive stage. And then also the challenge is systemic and global, not organizational. So China, Thailand, and multinational pharmaceutical organizations all confirm that strong data governance transcends geography. My steep analysis looked at what the impacts really mean. So from a social perspective, the age of width matters here. Reducing clinician burnout by shifting repetitive claim tasks to AI is not just an efficiency win, it's a workforce sustainability issue. Then from the technological perspective, the key insight is sequencing. Data architecture must precede tool deployment. Economic, we see where over 2.7 billion annually is spent because of inaccurate data, inaccurate information. And environmentally, digital claims processing reduces paper volume, which is excellent for the environment. And from the political perspective, regulatory pressures from CMS, ONC, HHS is effectively mandating the data modernization that AI requires. My analysis looking at regulation, ethics, and global implications. Regulatory compliance as a driver, not just a constraint. So regulatory bodies such as HIPAA, the No Surprises Act, and CMS/ONC HHS interoperability mandates all require the same data accuracy and standardization that AI depends on. And as far as ethical considerations, Cleveland Clinic's insistence on human oversight in all AI applications is instructive for the general industry. And then from a global perspective, AI success in China, Thailand, and multinational pharmaceutical organizations confirm one thing. Data governance is not a US problem or a healthcare problem. It is universal. My overall assessment of the case and the research together led me to confirm that the solution is correct. The solution presented in the case by Wong correctly diagnoses the problem and proposes data infrastructure investment. But the harder question, how organizations fund and sequence that investment alongside ongoing operations, is left unresolved. This is a real implementation challenge. Then looking at the second area, the technology is not the bottleneck. This is the most important framework. The conversation in healthcare AI is dominated by algorithm performance and the other aspect of administering healthcare, and they're making wonderful strides, but it should also be dominated by data governance. Then from the Cleveland Clinic's case perspective is a very honest example. Unlike the pharmaceutical showcase example, Cleveland Clinic's case shows a world-class institution that is still constrained by data inconsistency. My personal reflection, what surprised me? I knew the inefficiency that existed with the data from the billing and coding perspective, but the depth that even heavily invested organizations like Cleveland Clinic face basic data entry inconsistency problem really has reset my assumption. So the surprise is basically built around the scale and also the Cleveland Clinic example. My personal reflection continues, looking at the parallels that I drew, and my supply chain background makes the Cleveland Clinic case viscerally recognizable. It's a different domain, but same root cause. And my medical billing and coding certification means I understand what it looks like when human has to catch what an automated system misses. Taking forward, 3 lasting lessons for me. 1, analytics failure starts before the analysis. And 2, AI is most effective when it enhances, not replaces. 3, data governance is a leadership problem, not a technical one. My reference page. Thank you.